can join us via Skype, Dr. Stuart and Dr. Teri Warner, who say they adjust infants on a daily basis. And clearly this is a growing trend for parents. And my biggest curiosity, and I'll openly tell you, the minute I finish taping here, I'm going to see my chiropractor. I'm a big fan, but I have a lot of concerns with this.
It may be new to you, but chiropractors have been adjusting kids for over 100 years. And tens of millions of adjustments are safely and effectively given to children each and every year.
If you look at our malpractice rates, we pay a fraction of what other doctors pay because what we do is safe. And a good comparison to put moms at ease is if you look at the amount of force used in the average birth process, it could be upwards of 20 to 40 pounds of torsion and traction on that newborn's neck, who doesn't even have the musculature to hold their head up. And you compare that to a few ounces or a pound of carefully directed pressure in the right direction, in the right time, there's no comparison. And parents today are understanding and recognizing the important role the spine and nervous system plays in that child's health and well-being.
I think the biggest issue is you're taking a 12-day-old and making adjustments, and a healthy 12-day-old baby, I don't.
What adjustment do they need?
Other than maybe parents feeling like there's a benefit, what really is the purpose?
Absolutely. The position the baby's in utero, and the birth process can be very traumatic on a newborn. So it's very important to evaluate that baby to make sure everything's in alignment and moving properly, because if it's not, it'll put interference in the nervous system that can compromise that baby's ability to be well. So babies that get adjusted and we remove that nerve interference, the body can heal better, function better, and work better.
So may I say, as a board-certified OB-GYN, I would not necessarily equate the delivery process to what I've seen in the videos. And I've met a lot of babies who have grown up nice and healthy without having these adjustments. So I realized that in medicine, you know, we grow and we evolve and we learn. And one day, this may be the standard of care in America. But as of today, for myself and other individuals who have concerns about this, can you direct us towards great studies that prove that this is not harmful, and great studies that prove that there is some benefit? Like, is there a meta-analysis to look at this situation?
There certainly are more and more studies being done all the time, and that data continues and is showing the efficacy of chiropractic care for children. But the truth is that the proof is in the patients and the millions and millions of moms and dads who will testify as to the life-changing benefits that chiropractic has had for their family and their children. And we hear it day in and day out. In our 24 years in practice, we've seen nothing but children really benefiting from this.
So what are the potential complications?
Should a patient have something called atlantoaxial instability, that's specifically where the skull abuts with the first vertebrae, if that's unstable and you don't know that that's what the patient has, and you go ahead and do your manipulations on the neck, it's over with. Or if we have a patient that has spina bifida, where their vertebrae are not completely whole, and we do these cracks with these forceful manipulations on the body, again, we can have detrimental neurological damage that can last for the patient's lifetime.
The conditions that the doc just mentioned are things that during our history, during our exam process, we're going to be able to find that out. They will have been to their pediatrician. They are at getting treatment for those types of conditions. Adjustments for a newborn or a child, an infant, are very different than adjustments that you might be traditionally thinking about for an adult. To understand the amount of pressure that's used, if you were to take your finger and just press it on your eyeball comfortably, that's about the amount of pressure that's actually used. Or if you were to squeeze a ripe tomato and you could feel that, that's the gentle pressure that, if applied in the right place, in the right direction on the child's spine, it can vastly change and improve their health.
My words of advice, if you're considering this, make sure you get the okay from your pediatrician.
Yeah.
I will say I'm dubious. A 12-day-old baby, it just makes me personally nervous. When it comes to healthcare, it's all about getting the right care at the right time and trusting your healthcare provider. So just have good relationships with your healthcare providers.